Humanity is entering a pandemic era. There are nearly 1.7 million viruses in nature, and of those, only 0.2% of them have actually been studied. We started this company in 2017 for the following reasons. We observed there were 189 million days of school missed every day, every year due to the Common Cold alone. There are 48 million cases of foodborne illnesses, which leads to 128,000 hospitalizations and 3,000 deaths. But most importantly, there are a billion cases of the Common Cold every single year. This means adults get sick 2 to 3 times a year, and kids almost twice that. These diseases have a devastating impact on our communities. So they cost us about $1 trillion with 70 million deaths. And when they are not properly managed, like COVID, they can cost as much as $16 trillion. We believe that the future of healthcare is going to be in disease prevention. By preventing diseases, you can rechannel funds to other innovations as well as cures to actually make sure we live a safer and in a better world. So we came up with a formula. So what exactly is our formula to prevent diseases? The first thing is really around gaining knowledge. Can we actually make people health literate, create engaging content from trusted sources that they can interact with? The next thing, can we leverage existing technologies, hardware, software, in order to continue to encourage these practices and to sustain this learning? And finally, can we collect data on how these new technologies are actually making our habits and our behaviors better? And that's really how you come up with a safer community. So how would this actually work? What can we use it to solve? Hand washing. 95% of people do not wash their hands properly. This is extremely important because 80% of diseases are spread through touch. The correct way to wash your hands is for at least 20 seconds with soap and water, but a lot of people do not do that. This means 95% of people are vectors of diseases into their communities. That's why we designed Opal. Opal is an IoT platform that uses education, behavioral design, and data to encourage and sustain healthy hand hygiene practices. So how exactly does it work? So this is our prototype here. So you can actually see it, and I'll give it to pass around the room. So we have a small device. It sits right beside your faucet. So once you come close enough, it detects once you come in front, and it gives you instructions to wash your hands. Get some water, get some soap, and then it shows you the actual hand washing process, right? Wash between, wash behind, wash around your thumbs, wash your fingertips, wash your fingertips again, wash your fingertips again, wash your wrists. I see everyone's faces looking because they clearly don't do that. And then you rinse your hands. 20 seconds. That's actually how you wash your hands properly. So how does it work? How does it fit into our formula? So what we've really done is that we've created engaging content to educate people on how to wash their hands properly, as I showed earlier. The next thing is that we're using a connected device. By that I mean we actually have a wireless connectivity that can upload content. So we know that behavior change is difficult. We can show you how to wash your hands today. We can see an uptick in people washing their hands, but what else can we show them? That's why we designed our device to be able to update this wirelessly. And finally, we collect the data. We collect data on how people wash their hands, how we've actually helped them change things, and whether it gets better. And that's how we want to create a safer community. So what exactly does our product look like, and how did we start? We started with this idea that we can get people to wash their hands. We're just going to put LEDs. Once we put LEDs, they're going to be we know. We realized very quickly that no one had any idea how to wash their hands properly. No one actually knew, or people didn't actually know you were meant to wash for 20 seconds. So we were can we design something better? We created our next device. Okay, can we attach things to faucets? And we realized there are a million different kinds of faucets. You can't design for all of them. We changed again. So we came up with our MVP. Can we put something that's going to be right beside your faucet? And that way we can detect things. And that's how we arrived at our end. We tested this across schools over 2017 to about 2020. And that's how we came up with the engineering prototype, which you're going to have an opportunity to touch. So what does our market look like? So we're estimating about an $85 billion market that cuts across these 3 places: office buildings, K-12 schools, as well as people in food handling and manufacturing. So we have current customers that we're working to pilot with Portal Innovations in Chicago, the Academy of Global Citizenship, and then a Subway franchise. And we plan to work with one place, really understand how it works, and see whether we can scale through that. So why will people want to use us? Why do people want to talk to us? The first thing is really we serve as a symbol of community safety. You come in, you know that people are making a concerted effort to make places safe. Next thing, we can help reduce absenteeism in schools, which is directly tied to how much money they get in funding. And finally, really around reducing foodborne illnesses. So let's look at like a very simple idea about how it will work. So we have 450 students in a school. Assuming we can reduce the spread of diseases by only 20%, we can save about 810 school days. And by saving those days for that school, we can save them about $40,000. What's our business model? It's really about educating, informing, and trying to protect your community. So we want to assure that we can get you to actually comply with hand washing practices as required by the FDA. So this is really teaching people the right technique to wash their hands. Next thing is around community safety. Can we make people feel safer as they go back to work, as they come back to school? And then getting that tailored content and showing how that tailored content actually works. So we're currently charging $200 per device and $120 a year per device. So that's more or less our business model. So we also have a hypothesis that we can actually get this to people faster by going through the route of sponsored content. What would that look like, right? We can deploy our product for free. We can create hyper-localized content. Let's say Nike wants to be able to put something within an office. They can say like, hey, we want people to exercise more. We want to put this kind of content. We want to tell people to remember to go check their blood pressures. We want people to make sure they can do all those things. So who is going to pay us to do that? So that's a hypothesis we are currently testing. So we can then profit share with whichever organizations we are deploying to. And if you want to get an idea of what that really looks like, it's about $6 to $13 per 1,000 impressions. So we're still working through that process, but we wanted to make sure we can share that today. So who are we competing with? So we have two competition, but we'll actually focus on the hardware, and over the course of the questioning, we can talk about the software. So what makes us really stand out from our competitors? Number one, ease of use. We have a simple formula. You buy an opal, you pick an opal, you drop an opal. That's the idea, right? It detects you automatically, and it shows you the content, and we change that wirelessly. We actually collect data anonymously, and this is very intentional because of the places where our devices are going to be placed. We do not have any cameras. We do not have anything. And we've tested consistently to find what's the right size of sensor that will actually make it work. And the last thing is really around like customizing that content. So who are we? We're hungry, we're inspired, and we want to change the world. Myself, I'm an SMU MBA. I have worked with semiconductor distribution for several years, and I've worked several years as an electronics engineer building electronic devices. My co-founder is a venture fellow at Deep Work Capital. He's a graduate from Northwestern University, and also worked on one of the largest communities, like looking at the Chicago health indicators and how it actually impacts that. We have a PhD that is also like a public health specialist, and we have I that really drives our marketing. So we're an award-winning organization, right? So we've won competitions from SMU to Northwestern to the Chicago booth. And we've raised $150K from an angel investor, the co-founder of Coupons.com. Most recently, we got some money from Fifth Star Funds, which is a pre-seed investor in Chicago. So we were admitted into one of the largest accelerator programs in the United States, and we were named one of the most promising student startups in 2019. So what exactly does our financial plan look like? So we believe that after we run our initial prototypes and tests, that's where our business is really going to take off. We're looking to do about 1,000 units in the first year. And more than that, we'll get about $260,000 in revenue. And then if we look at like the second year and the third year, we can get as much as $11.2 million in revenue, coming out to be 6.8 after in gross revenue. So when you think about what we're doing, we can sort of dive deeper into like, what those numbers look like. So we're looking to raise about $1.5 million to get to our Series A round. We'll really be focused on product development, hiring the right people, and then really driving our strategy through sales and marketing. So those are the things that we really need money for, and we can dive deeper into that in questions. And so that's to get us to case studies, to get us to revenue, and really show the impact. So what does this look like? So we have 200 prototypes right now that we're deploying and that we are testing with. So over the next year, we want to be able to get our dashboard that can show the analytics of the people that we work with. But more than that, we really want to get to our content management system because we believe there's a very interesting business model that comes there. So by 2023, we really want to start integrating to Syncs and then licensing our product or our technology so we can make sure like that becomes the standard for sync manufacturers around the world. So the one thing we want to ask you is, think about the platform. Think about the formula. What else can we do? We're talking about people eating healthy. We're talking about mental health. We're also talking about improved hygiene, just as a general rule of thumb. And we believe that the current trends must change. Right? The way we are is like there's a lot of panic, misinformation. can we get to a better future, a healthier future? One that we learn about things, we can change negative behaviors, and we can prevent infectious diseases. Thank you so much.